And once again, I want to say greetings to each and every one of you. Aquaba and welcome. Welcome to another round of the Conscious Rasta Report here on LIB Radio, LIB TV, and livinginblack.com. My name is Kidi Obi Awadu, aka the Conscious Rasta. Weekday mornings, you and I get together live. We come at you from 9 a.m. Pacific time, that's 12 noon Eastern time, 5 p.m. GMT, and 8 p.m. East Africa time. We get together with you. And we deal with culture, consciousness, historical perspectives, entertainment, economics, education, health, labor, law, politics, family, communications, future studies, all areas of human interactivity and development. Today's date is Tuesday, the 20th of January, the year 2026 in the Western calendar. This corresponds to the year 6266 in the Kemetic calendar, to which we've realigned our cultural clock. Welcome to the 7th millennium. You have found your family in a peaceful place here on LIB Radio, LIB TV, and livinginblack.com. And I think I got all the buttons in the right place this morning. I feel good. I hope you are in good spirits here as well today. And I have a program I'm going to share with you today that I think you're really going to find practical, very useful. And that's key and critical to our desires. We want our lives to be practical and to be as fulfilling as possible. I say greetings to you, my sister for Africa One. I see you in the house, Sawabona. I see you. And we see each other on a whole different level. And I do love the fact that you are with me today. And I hope you find this to be useful conversation. Here's what we have on tap for today. The topic is a functional medicine approach to nerve pain. Functional medicine approach to nerve pain. Welcome to the Conscious Rasta Report. Today, we're exploring a functional medicine approach to neuropathy. That's neuropathy, a condition affecting millions worldwide. We'll dive into powerful herbs and supplements that support nerve health. We'll discuss targeted exercises for symptom relief and examine how anti-inflammatory responses can transform your healing journey. Whether you are directly seeking natural alternatives or complementary therapies, today's episode offers holistic strategies to reclaim your nerve function and overall wellness. So that is what we have on topic for today, a functional medicine approach to what many refer to as peripheral neuropathy, sometimes referred to as idiopathic peripheral neuropathy, meaning I don't know what's causing my toes and my fingers to hurt so much. That's idiopathic. But we're going to focus on identifying and treating root causes. That's functional medicine. Identifying and treating root causes, including metabolic causes, toxin, who may be exposed to toxins, immune system, structural, nutritional, while using targeted nutrients and botanicals that have at least some human data for symptom relief or nerve function support. The evidence is strongest for certain B vitamins, alpha lipoic acid, acetyl-L-carnitine, and some herbal formulas in diabetic and chemotherapy-related neuropathy. Many others are promising, but not definitively proven. Today, we're going to function on what can be definitively proven. I've also got a few things I'm going to share with you. I did this video just this morning I put together on functional medicine and nerve pain. And this is up on my Rumble page. And here, let me just copy this and go and paste this up here. Oops, what was that? Oh, functional medicine and okay, so I have all of that. I'm going to share that link with you as well. So you can have access to this wherever you are. I'm putting this link up. And for Africa One says, Hotep Brother Kitty and Global LIB family. I want to make sure I got your actual words in as we're asking people to share their thoughts when you tune in. Tell me what you think about today's broadcast. I'm going to mute my microphone and play this. You will hear the video right now.
Totally different angle than just masking the problem. Let's talk about nerve pain, but from a totally different angle than just masking the problem.
So is there really more to it than just managing the pain? People are definitely looking for real answers. Well, this approach is all about finding the why. Why are the nerves acting up in the first place? And that why can be anything, from metabolic stuff to toxins, or even what you're eating. So the strategy really boils down to 3 key things: less injury, better blood flow, and more nutrients. All right, first things first, we've got to build a solid foundation with some powerful lifestyle strategies.
First up, getting a handle on your blood sugar. This can seriously slow things down.
And then there's diet. Think lots of plants and good fats to fight that underlying inflammation.
Movement is also key. The right kind of targeted exercise can make a huge difference in pain.
And you know, sometimes it's about what you remove. Getting rid of hidden toxins can be a game changer.
Okay, foundation set. Now let's really interesting. Each of these nutrients has a very specific job to do.
Take alpha-lipoic acid. It's a powerhouse antioxidant and is strong. Then you've got ALC. This one seems to actually help rebuild nerve fibers, hitting pain at the source.
And the list keeps growing. We're seeing some really promising stuff with vitamin D and omega-3s too. All right, let's move to the top of our pyramid, the botanicals.
Now with herbs, the evidence is a bit more mixed, but it's definitely promising and growing.
But for neuropathy that's caused by chemotherapy, that's where the data is getting really compelling. In fact, a huge 2023 analysis found that certain traditional herbs can make a significant difference. And get this, they even pinpointed this specific herbal pair as being super effective. So you see how it all stacks together? It's a structured path, building from the ground up. The big idea here is that you're in the driver's seat, building your own comprehensive strategy. So the real question is, what's going to be the very first piece of your foundation?
Where do we begin? Where do we begin? If you're dealing with this condition called peripheral neuropathy, you do want to start as soon as possible. I've been dealing with this condition on and off, and it really comes on in the colder weather. My feet get cold, my toes get cold. I do run every morning, and that's a bit of a trip. But it's not so bad that I can't manage it. But I want to eliminate this idiopathic peripheral neuropathy. Now, I know my blood sugar is not high. I keep my blood sugar pretty well, and I'm very, very sensitive to my insulin levels. And there are certain things that I do lifestyle-wise, such as intermittent fasting, periodic detox, 3-day fast, 1-day, 24-hour dry fast. Those type of things all keep my blood sugar very much in line. So I don't really worry about that, but still the condition persists. So something is out of balance. So we're going to go into a report that I put together today. Excuse me. And where is this report at? Behind that at, my daddy would say. And I'm going to find it here. Here it is over here. And I have put together this report using this is using notebook, Microsoft's notebook, and I think I have it up here. No, that's a different one. And where is it? I'm looking for Microsoft's notebook, Functional Medicine Approach. Here it is. Here it is. So I put together this report, a functional medicine. Oh, first of all, I have a couple of things I'll show you before I show you the report. This is an infographic, a one-page information sheet that I put together on this topic today. And bear with me as I put this on my desktop, share the infographic, share screen. I'm sharing functional medicine approach to nerve pain. Okay, now you should be able to see my screen. I should have put this all on one page. You should be able to see the screen right now. And what you're looking at is the infographic that I put together this morning dealing with the topic. A root cause approach to nerve pain for a functional medicine guide. Functional medicine treats nerve pain by identifying and addressing underlying root causes. Functional medicine deals with causes, not just treating the symptoms and suppressing the symptoms with narcotics, drugs, such as metabolic issues, nutrient deficiencies, or toxins, rather than just managing symptoms. This approach uses a combination of core lifestyle changes and targeted evidence-based nutrients and botanicals to support nerve function and reduce injury. So, pillar number 1, under functional medicine, identify and treat the root causes. Look beyond the symptoms. Investigate metabolic, toxic, immune, structural, and nutritional drivers of nerve pain. Next, utilize comprehensive analysis. Combine detailed history with labs. Under functional medicine, we do refer to lab tests. The A1C, that's to test your blood sugar level, see if you are hyperglycemic. B12, that's another critical nutrient that we vegans do need to approach with the right supplements. And nerve function tests. The second pillar, build a healthy foundation. Control blood sugar. Tight glycemic control is proven to slow the progression of diabetic neuropathy. Adopt an anti-inflammatory diet. Focus on whole foods to lower oxidative stress and improve metabolic health. And 3, incorporate targeted movement. Physical therapy and balance training can improve both physical function and take care of the pain. And pillar number 3, use targeted evidence-based support. The first thing they mention is the nutrient supplement alpha lipoic acid, one of the best supported agents. Multiple trials show it improves diabetic neuropathy. Acetyl L-carnitine, and both of these are in my anti-aging arsenal. Acetyl L-carnitine, proven to improve pain and nerve regeneration in diabetic and chemotherapy-induced neuropathy. And third, traditional herbal medicine, THM. In this case, a big focus on traditional Chinese medicine. A 2025 meta-analysis found it significantly reduced chemotherapy-induced neuropathy incidence. So that is the one-page infographic that I put up on this. Next, I have a slide show I'm going to share with you right now. And the slideshow is here. Here's the slideshow. And this is in Adobe Acrobat. So here is what the slideshow says. Now, let me make sure you're looking at what I'm looking at. And StreamYard. Okay, you have the slideshow up on your screen right now. Here is what the slideshow, Reclaiming Vitality, a functional roadmap for nerve health, from root cause to resolution, an optimistic roadmap for healing. The optimism, the mental state is very, very much a part of our healing. We must shift focus from suppression to resolution. This is functional medicine. The symptom suppression, that's your traditional Western medicine approach to peripheral neuropathy, while functional resolution is to restore, revitalize, and rejuvenate your nervous system. Conventional treatment often focuses on masking symptoms. It manages the pain signal without addressing the signal's origin. While functional medicine, functional resolution, to heal, we must identify why the pain exists. The functional framework targets 3 specific goals. Number 1, reduce drivers, mitigate hyperglycemia, not hyperglycemia, oxidative stress, inflammation, and compression. 2, improve microcirculation, enhance blood flow and mitochondrial function in distal nerves. And 3, replete nutrients, correct specific deficiencies to gain central sensitization. You cannot fix what you do not measure. Clarifying the neuropathy type and mapping the symptom pattern is the prerequisite for treatment. Diagnosis is not just a label, it is a map. That's a very important statement. Diagnosis is not just a label, it is a map. So we're investigating our checklist. What about metabolic? We got to find out our A1C and fasting glucose level. Oral glucose tolerance test is another test that will be used. Nutritional, vitamin B and methylmalonic acid, folate and homocysteine, vitamin B6, and vitamin D, all very critical, and they must be in balance. Number 3, toxic and structural. Are we talking about heavy metals? Are we talking about liver and kidney function? CPEP or SPEP, serum protein electrophoresis. And then diagnostic testing, neurologic exam, EMG nerve conduction studies, small fiber testing when indicated. So these panels, we need to seek these panels out and get the solution to those. And that is very much a part of functional medicine. Phase 1, clearing the biological interference. Here's solutions. Glycemic control. Tight but safe glucose and A1C control is the primary driver for slowing progression in diabetic contexts. An anti-inflammatory diet. Emphasis on polyphenol-rich plants, quality proteins, and omega-3 fatty acids. Crucially involves the removal of ultra-processed foods to lower oxidative stress. That ultra-processed foods is very, very critical. And then 3rd, toxin removal. Identifying sources such as mercury or environmental toxins. Case reports show correlation between detoxification and symptom resolution. Okay, we're on a roll. I think we're moving, and I am definitely hearing my solutions inside of what we're sharing, and I'm going to sip to that. My morning tea, as you all know, it's got a magical set of formula. It's a beautiful thing. Let's continue. Phase 2, reactivating pathways with movement and light. Mechanical activation, targeted physical therapy, including gait work and balance training, improves function and reduces pain in integrative case studies where they integrate these other practices other than standard drug-centered medicine. When they integrate these things in, they find that the movement it works so well. And I am engaging in 5 different exercise periods a day. I am engaging in Tai Chi and gait improvement and balance training. Yes, I am doing that. Photobiological activation. This is just could be just a matter of simply getting outside in the daytime light between 10 a.m. and 2 p.m. and allowing yourself 15 to 20 minutes of direct sunlight. Photobiological activation. The therapy, low-level infrared light therapy. Mechanism, it enhances microcirculation and angiogenesis, the formation of new blood vessels. Status, emerging evidence. Case series report improvements, though large-scale data is still developing. Number 3, fueling nerve conduction. The B complex is a clinical stronghold of nerve repair. B complex. The evidence, a meta-analysis of 14 RCTs, that's 13 randomly controlled trials, that's RCT, involving 1,384 patients, confirm that vitamin antioxidant supplements improve sensory nerve conduction velocity in diabetic neuropathy. Key agents are benfotiamine and thiamine. They're vital for glucose metabolism. And then there's methylcobalamin, B12, and folate. Again, these are all B complex. Benefit is greatest when deficiency or glucose dysregulation is present. So that's useful for if you do have that glucose dysregulation, that would be hyperglycemia. Restoring mitochondrial function. Alpha lipoic acid. Context. ALA is one of the better supported integrative agents with multiple remote control trials supporting its use. The mechanism, potent antioxidant effects, reduce oxidative stress, improves glucose metabolism, and that combats that glucose dysregulation, and supports mitochondrial enzymes, the power plants of the nerve cells. And the clinical outcome demonstrated improvements in both neuropathic symptoms and nerve conductor parameters. Energizing the cellular batteries, acetyl-L-carnitine. Clinical application, remote reviews note clinical trials where ALC improves pain scores and nerve fiber regeneration. So that's going to be helpful all throughout our body. And that graphic you're looking at there that's the glutamate uptake between our different nerve cells. The energy must transfer between the nerve cells, and that's the glutamate environment there that's being described. So it's really, really critical. And this happens tens of billions of times per second, all throughout our body. Very important. Differentiation, most helpful in painful polyneuropathies, meaning more than one. Most helpful in painful polyneuropathies rather than cases of pure numbness. Note, benefits appear dose dependent. So take that longevity supplement, acetyl-L-carnitine. If you got my book, it's called Living Superfood Longevity. Living Superfood Longevity contains my anti-aging arsenal of, I think there's 52 supplements in my arsenal. And acetyl-L-carnitine is definitely one of my favorites. Going forward, building structural resilience. Not vitamin D. The link, observational data correlates low vitamin D levels with greater neuropathic pain. The fix, correction of deficiency, leads to symptom improvement in small trials. Omega-3 fatty acids. The role provides neuroprotective and anti-inflammatory effects. The context, small studies suggest potential benefits specifically in chemotherapy-induced contexts. Ancient wisdom and botanical synergy. The featured protocol. Chinese herbal formulas such as Huang Qi, Guizi Wu based regimens. Huang Qi, Guizi Wu based regimens. Excuse me, my Chinese is not very good. But we're talking about wisdom, ancient wisdom. Evidence, retrospective studies show meaningful reductions in pain severity for diabetic peripheral neuropathy. Combinations, including aconitum species, show promise for improving EMG findings. Safety warning. High emphasis on the need for expert supervision regarding quality control and safety, meaning be careful going to Amazon or VitaCost or wherever you go and just ordering this stuff on your own without it being supervised or overlooked by a practitioner who is familiar with functional medicine is very, very key and critical. So addressing numbness and cold sensations. The Japanese protocol, this from Gosha Jinkigan TJ 107. So I guess that's a study. Profile. A Japanese kampo formula of 10 herbs, widely used for numbness, cold sensation, and dysesthesia in diabetic neuropathy. The clinical data, phase 2 randomized double-blind placebo-controlled trials suggested delay the onset of oxaliplatin-induced neurotoxicity in colorectal cancer patients with good safety. So if you are a colorectal cancer patient and you're experiencing peripheral neuropathy, we got you covered. Specialized care. And this is, if you are that colon cancer patient, chances are you may have been exposed to chemotherapy. Specialized care in case of chemotherapy-induced neuropathy, CIPN. New evidence. A 2025 systematic review and meta-analysis on traditional herbal medicine. The findings, oral traditional herbal medicine significantly reduced the overall incidence of chemotherapy-induced neuropathy compared to usual care. It improved nerve condition parameters with no serious adverse events. So the winning pair, astragalus radix, that's astragalus, cinnamomum ramulus, and that is, of course, a cinnamon derivative, emerged as the most frequently used and effective pairing. So astragalus, along with cinnamon, we can make that work. Relief from the outside in. These are topical and emerging interventions. Number 1, topical citrullus colocynthis. And that's the name of the herb. Evidence double-blind randomized trial showed reduced pain in painful diabetic polyneuropathy over 3 months compared to placebo. Other candidates, botanicals like curcumin. That's the key active element that is in turmeric. Boswellia and capsaicin, the key element in cayenne pepper, have preclinical data or limited clinical data. Note, evidence is often animal-based or for other conditions, so these are secondary to the primary protocols. Let's talk about the integrated protocol. Excuse me. There is no single pill. The solution is an ecosystem, meaning they're all synergistic, beginning with glucose and diet control, extending to ALA, the supplement, alpha lipoic acid, topicals, vitamin D, ALC, that's, I can't remember what ALC stands for. I've been talking about it all day. We'll get that back in. Light therapy, movement and sleep, that's exercise and sleep. B complex, botanicals, and light therapy. So ALC, stands for acetylcholine. That's ALC, acetylcholine. So creating the biological environment for healing. Well, there is no magic cure. Biology is dynamic. By removing the drivers of damage and flooding the system with targeted support, we create the conditions where repair can occur. From darkness and pain to light and function. Also, consult with a functional medicine provider to map this roadmap to your specific labs and your specific history. And that's very, very much recommended. So there is the formula for creating the biological environment for healing. Next, and that I really, really like that. If you would like to get a copy of that, you just drop me an email message. You know how to contact me. And now I want to talk about the clinical management protocol of functional medicine. So this is the report. I want to share this report. How do I get this larger? Oh, that wasn't it. Clinical management. And well, I'm just going to copy all of this because I actually have much of this already put into the document that I prepared for today. So what I'm going to do is I'm going to go over here and I'm going to reduce this page, remove that, and I'm going to read from my prepared document on this topic of a medicine approach to nerve pain. A functional medicine approach to peripheral neuropathy focuses on identifying and targeting root causes, metabolic, toxic, immune, structural, and nutritional, while using targeted nutrients and botanicals that have at least some human data for symptom relief or nerve function support. The evidence is strongest for certain B vitamins, alpha lipoic acid, acetyl-L-carnitine, and some herbal formulas in diabetic and chemotherapy-induced neuropathy. Many others are promising, but not definitively proven. And I just want to take a second here. Where are we at? Where are we at? Behind that at, my daddy would say. And bear with me. Here we go. And I'm going to punch in what was just produced in my other report. And it is rather lengthy. It is very lengthy. And I'm going to read through as much of it as you can tolerate in our listening audience, because your toleration level may be rather low. Where are we at? Behind that at? Okay. Critical management protocol. A functional medicine approach to peripheral neuropathy. Point 1. The clinical rationale and functional framework. The clinical management of peripheral neuropathy requires a decisive shift. Now, bear with me. I'm just trying to format this in the background. A decisive shift from palliative symptom suppression to a root cause functional medicine framework. Relying solely on gabapentinoids or antidepressants to mask neuropathic pain ignores the progressive biological degradation occurring at the axonal level. To facilitate genuine nerve regeneration and distill functional restoration, the practitioner must systematically identify and mitigate the metabolic, toxic, and nutritional drivers that perpetuate cellular injury. By addressing these upstream insults, we create the physical environment necessary for mitochondrial recovery and axonal repair. Mitochondrial recovery and axonal repair, meaning this is happening inside the cells, living cells, where the mitochondria is driving this neuropathy. Now, bear with me. I'm trying to format and talk at the same time, and that don't work so well. I do see Shavaka is in the house. Greetings, Baba and LIB family. I'm happy to be here to learn more about my health care regimen. And it's a pleasure to have you with us today, my brother. You have found your family in a place of peace and learning. And thank you both for Africa One and Brother Shabaka for being with us today. And I know you have probably already hit the like button. And I do encourage you to do so. Eddie McCrory, I see you in the YouTube family. And Eddie is always going to be welcome. I have other information that I found today. Let me just paste in. You have the video that I played a little bit earlier. And I've got some other information here I was going to share. This is very important. This is from the government website, National Institutes of Health, medicinal herbs in the treatment of neuropathy. I'm going to post that link out. There are 4 other links that I got today, and I'm just posting them up as best as I can, and I'll do it a little bit later. So let's go back to where we were. We're back here. And primary functional goals. Number 1, the primary goal is mitigation of the primary drivers, aggressively addresses hyperglycemia, oxidative stress, systemic inflammation, environmental neurotoxins, and mechanical compression. Another primary functional goal, optimization of the endoneural environment. Endo meaning inside the body, neural environment. Enhance microcirculation and mitochondrial bioenergetics with distal nerve fibers to support energy-dependent repair processes. And the third strategy, neuromodulation and repletion. Correct specific micronutrient insufficiencies and modulate the nervous system to dampen central nerve sensitization. So clinical success is predicated on high resolution classification, identifying the specific etiology, meaning where did it come from? What was the pathway? How did we get here? Whether diabetic, pre-diabetic, chemotherapy induced, autoimmune, or toxic is the first step. The first step is system mapping. System mapping. such as stocking glove, quote unquote, distribution versus focal mononeuropathy, and characterization allodynia versus anesthesia are not merely diagnostic exercises. They dictate the subsequent therapeutic pathway and the prioritization of interventions. Bear with me. My eyes and my tongue and my mouth are all in different places today. This transition from clinical therapy to objective assessment requires a rigorous diagnostic mapping process. So, number 2, we need a comprehensive assessment and diagnostic mapping. To resolve peripheral neuropathy, the practitioner must utilize high-resolution diagnostic mapping to pinpoint the exact physiological insults. This process moves beyond the, quote, idiopathic label by investigating the hidden metabolic and hidden environmental triggers that drive nerve dysfunction. Again, idiopathic meaning of unknown cause. Practitioner checklist. Comprehensive history and exogenous insults, meaning insults from outside the body, exogenous. Very key and critical. We must know the difference between endogenous and exogenous. A thorough history must prioritize the identification of both metabolic dysfunction and external stressors. That includes point 1, metabolic glycemic history, assessment of insulin resistance, pre-diabetes, or established type 2 adult onset diabetes. 2, exogenous toxic insults, evaluation of alcohol consumption, heavy metal exposure, specifically mercury, and history of neurotoxic medications such as chemotherapy and statins. Point 3, nutritional exposure and risk. Evaluation of both B vitamin deficiencies and potential toxicity from supraphysiologic B6 supplementation. And B6 is a very necessary part of our natural health, but B6 is not going to be tolerated in such high amounts. And point 4, infectious immune drivers or autoimmune markers. Autoimmune markers are essential to understand. That's going to be your nutritional practitioner is going to, your not nutritional practitioner, your functional medicine practitioner must do these comprehensive assessments. Essential laboratory biomarkers include, and there's biomarker, clinical rationale, and so we're talking about HbA1c as your first biomarker. We're going to be assessing whether or not it is in range. That is your fasting glucose level. And fundamental markers for glycemic-driven oxidative stress and advanced glycation end products. So bear with me. The next would be vitamin B12. Assessment of circulating B12 levels, however, may mask functional deficiency. Third, methylmalonic acid, MMA, methylmalonic acid, is a critical functional marker, a superior indicator of cellular B12 status. Elevated MMA confirms functional deficiency with normal serum B12 And this is something that we vegetarians do have to be concerned about, is our vitamin B12 levels, because B12 is commonly gotten into the human system by eating meat. And because we do not eat meat, we have to be concerned about where and how much B12 we need to be getting. So bear with me. Folate and homocysteine, these are indicators of methylation capacity and nervovascular integrity. And vitamin B6 is necessary to screen for both deficiency and iatrogenic toxicity, which can paradoxically cause sensory neuropathy. And iatrogenic, that means injury or death by medicine. So in attempting to correct that, we may be getting too much of the it says vitamin B6. Now, I didn't mean to say that. I'm thinking of omega-6 fatty acid. So vitamin D correction is necessary for patients with chronic pain, as low levels correlate with increased pain scores. And then there is another set of tests called SPEP, and that stands for serum protein electrophoresis, utilized to screen for monoclonal gammopathy of undetermined significance, MGUS, or other immune-mediated drivers. There's a heavy metal screen. The heavy metal screening indicated in idiopathic cases to identify neurotoxic loads, particularly mercury, and also indications for advanced testing. The clinical strategist must know when to escalate testing. Electromyography and nerve conduction studies are the gold standard for large fiber assessment. However, when these tests return negative results in a patient presenting with severe burning pain or autonomic dysfunction, small fiber testing, such as skin punch biopsy for intraepidermal nerve fiber density, is indicated to identify small fiber neuropathy, SFN, that large fiber studies cannot detect. These findings directly inform the foundational lifestyle interventions. And these are all very, very important. And let's just highlight these. I'm going to put the bullet marks on each of them. I know the text is getting a little complicated. I know it's kind of hard to follow. But this is, if you want to understand the difference between functional medicine and just going to the doctor and the doctor prescribing you drugs, this is what the difference is. Let me just take a pause here, take a deep breath, and see if anybody's still with me. You may have some questions or comments. You may be familiar with much of what I'm talking about today. I'm going to go, while we're waiting to see if anybody wants to respond, I'm going to go and find another of the references that I pulled together for today's conversation. I did put up medicinal herbs in the treatment of neuropathic pain. Here's another one, another reference. This one is a little bit longer. It probably won't fit on one posting. No, it did. And let me just share it on my Facebook page as well. For those who do watch this live on Facebook, I appreciate you being in the house today, no doubt. And let's go to the next point. And I'm going to start to focus in and begin to kind of close out the dialogue today. We talked about a lot of different things, and I got so much more research on the table. And right now we are up to, let me get rid of this call. Okay, we are continuing. We're up to, last point we talked about was foundational lifestyle and pharmacological interventions. This is very important for those of us who rely on functional medicine and are avoiding pharmacological interventions. Lifestyle modifications are the non-negotiable substrate of this protocol. Without stabilizing the metabolic environment, the quote biochemical noise of hyperglycemia and inflammation will render nutritional and botanical therapies clinically futile. That's very important. The biological noise of hyperglycemia can influence everything. Metabolic and nutritional directives. Glycemic control is the prerequisite for all nerve repair. I will repeat, glycemic control, controlling your blood sugar levels, is a prerequisite for all nerve repair. Tight, safe management of blood glucose levels is the only intervention proven to significantly slow the progression of diabetic neuropathy. The clinical directive is an anti-inflammatory, nutrient-dense diet characterized by, point one, high density intake of non-starchy vegetables and polyphenol-rich plants to combat oxidative stress. Point two, strategic inclusion of high-quality proteins and omega-3 fatty acids for membrane repair. And point three, elimination of ultra-processed foods to lower the systemic inflammation burden. It gives you that's great information right there in 3 bullet points. Please don't ignore them. Oops, wait. Don't do that. Do this. There are also ancillary and physical modalities, such as low-level infrared light therapy, utilized to enhance distal microcirculation and promote angiogenesis. Case studies suggest this can improve both subjective symptoms and objective nerve function measurements. There is manual physical therapy, massage therapy. It's essential for patients with proprioceptive loss. Focuses on gait stabilization and balance training to reduce fall risk. Toxic identification and removal. The correlation between environmental toxins and nerve injury is well documented in case reports. And identifying and removing sources of mercury or other neurotoxins is a vital, quote, removal of obstacle, unquote, step. Systemic detox support is necessary to transition the patient from a state of ongoing injury to one of recovery. This stabilization of environmental factors allows for the successful introduction of targeted nutritional pharmacology. Targeted nutritional pharmacology, that's what I do. And I hope you do appreciate, love it. I do love bringing the service to the people. And we do the best we can. Now we're talking about evidence-based nutritional pharmacology. Now it's going to be talking about what supplements you're going to be adding. These are evidence-based. So nutritional pharmacology provides the cofactors necessary for nerve conduction and mitochondrial enzyme function. While not a cure, these agents are pharmacological tools that are used to shift the energetic balance of the nerve cell toward repair. These include B complex, and everybody should be taking B complex every day. I highly, highly recommend you get on your B complex routine. B1, B6, folate. A meta-analysis of 14 randomly controlled trials confirmed that B vitamin combinations improve sensory nerve conduction velocity. Strategically, benfotiamine, lipid soluble B1, and methylcobalamin, which is B12, are preferred for their superior bioavailability and efficacy in correcting glucose-mediated nerve injury. Alpha lipoic acid is the most robustly supported integrative agent. It acts as a potent antioxidant and improves glucose metabolism while supporting mitochondrial enzymes. Both oral and IV routes have shown efficacy in improving neuropathic symptoms and conduction parameters. Next is acetyl L-carnitine, ALC. Unlike agents that only modulate pain, ALC has demonstrated the ability to support actual nerve fiber regeneration. Evidence suggests its benefits are dose dependent and most effective in painful polyneuropathies. And lastly, vitamin D and omega-3s. Vitamin D correction is vital for pain modulation, while the omega-3 fatty acid management, omega-3 fatty acids provide neuroprotective anti-inflammatory effects, particularly in the prevention and management of chemotherapy-induced peripheral neuropathy. And I'm going to have to upgrade and update my hemp seed oil. That's my main source of omega-3 fatty acids. I do use walnuts quite a bit. Olive oil is a great source of omega-3 fatty acids. I do my hemp seed pudding every day. I try and do it every day. That's a very good source as well. So you can never get too much omega-3 fatty acids. It's necessary for all repairs all across your body. It works on the cellular level to the skin integrity, etc. Typical ranges and windows of interventions in this protocol utilize pharmacological therapeutic dosing rather than standard RDA repletion levels. So pharmacological therapeutic dosing. That's critical. That's functional medicine rather than standard recommended daily allowance. That's from the FDA. That's like not even close. The FDA is not even close of what we need to be taking. We need to be in contact with a clinical nutritionist that knows where is your therapeutic dosing level. Clinical trials typically demonstrate that a 3-month therapeutic window is the minimum duration required to observe meaningful changes in pain scores or nerve conduction velocity. And then next is targeted botanical and traditional formulas. And I'm going to wrap it up with this 6. And even though I'm on a roll, this is all very, very good. Botanical medicine, herbs, complete molecular signaling that can modulate pain pathways and improve nerve health. Given the complexity of these formulas, expert supervision is mandatory to ensure safety and quality control. And I do definitely agree with that. Traditional regimens and clinical evidence. You have a bunch of studies. You have the modified Huang Qi Guizi Wu Wu decoction. That is a herbal formula, traditional Chinese medicine, used for moderate to severe painful diabetic neuropathy. This formula is often augmented with spatholabi, caulis, and glycyrrhizae radix to reduce pain severity and improve broader clinical symptoms. Now, I don't know what's in those particular formulas, but it's easy to find out, and it's easier to access these things much more facility today. And conitum combinations, research suggests adding a conitum species to Huang Qi Guizi Wu Wu Tang. It sounds like Wu-Tang Clan, right? Can reduce pain and improve EMG findings. Clinical warning: a conitum has a narrow therapeutic window and requires expert traditional Chinese medicine oversight due to potential toxicity. So there's a narrow window. You can't have too much. You can't have too little. You got to get it right. And it goes on, and the language is inaccessible to us. And it just talks about a systematic review of traditional herbal medicine for chronic idiopathic nerve neuropathy. Prevention concluded that these formulas significantly reduce the incidence of neuropathy and critically improve objective nerve conduction parameters. The pairing of astragalus radix and cinnamomum ramulus emerged as the most effective and frequently utilized core combination for neuroprotection during chemotherapy. Now, I'm going to look up that combination. I think that's astragalus and cinnamon, but I may be wrong, and I don't want to get that wrong and keep repeating that inaccurate. So I'm asking my search engine. Let's go over here. Where am I at? Behind that at. I'm going to go into this, and I'm looking for I'm adding sources. I want to search for, try deep search. I'm adding, no, I don't want to do that. I'm in Notebook. I have 63 sources in here, but I'm looking for specifically deep research, fast research. Why you treat me like this? I'm looking for what are commonly known as, and find me several sources for this information. Okay, so I typed that in my prompt. It's assessing the relevance of it, and it should beginning the investigation. Now I'm using AI. I'm using multiple AI engines for today's broadcast. It's addressing source limitations, pinpointing direct answers, and astragalus radix and cinnamomum ramulus, commonly known as, and it says, based on the provided sources, astragalus radix and cinnamomum ramulus are identified as specific botanical pairing used in traditional herbal medicine to treat neuropathy. The provided text does not explicitly state the common English names for these Latin pharmaceutical terms. Information from outside the provided sources said Astragalus radix is commonly known as astragalus root. Got it. Or Huang Qi in Chinese. And Cinnamomum romulus, commonly known as cinnamon twig. Got it. Common context and source within the provided text. Although provided documents do not define the common names, they refer to these herbs and their association formulas in the following sections regarding nerve pain. Chemotherapy-induced peripheral neuropathy, and it talks about a specific study. Diabetic neuropathy, talks about that. So I got those right. I'm going to save to a note, and I put that one into my report, and I'm going to wrap it up right now. And I'm going to continue. I think we hit it pretty much on the head. Astragalus root and cinnamon, that is in a particular formula. And therefore, the formula must be balanced. So we can't just randomly just put in a teaspoon of sugar, or a teaspoon of cinnamon, and add that to astragalus root and think, oh, I got it right. But it does encourage you to use cinnamon to regulate your blood sugar, to increase your insulin sensitivity, to take the burden off of your liver and off of your pancreas, to help you regulate all of this. And there are more things that we could be doing. And so I hope you have been appreciated, or that you do appreciate what we did today. We have come a long way together, but we've got so much further to go. We're going to do the best we can, and we're always striving to get more information so that we can do even better in the future. I want to thank you for being here. You do mean a lot to me. I hope I do mean a lot to you as well. I trust I do, Brother Shabaki. You always remind me. And to you, Eddie McCrory, thank you for being in the house today. I am, because we are. I did share with you the video that I put up on today's topic. And Eddie, he says, flying guillotine, I see you in the house. He says, in sleep or relaxed, I have involuntary movements. That's interesting. And I need to know a little bit more about that. Maybe if you could real quickly. Eddie said it should be illegal for the sale of white crystal sugar in large amounts. Yeah, it should be illegal, but it's not going to be illegal. So you and I have discretion. Eddie says, my wife says, B complex changed my attitude. And I hope she said it changed it for the better. I see the pictures of you and your wife, and it makes me smile deep into my heart, because everybody deserves somebody really brilliant and really peaceful and happy to walk alongside life. And apparently, from what I'm seeing in the photographs of you and she together, she is just all of that for you. And I'm very proud of you, Brother Eddie. And I'm looking forward to having a companion to walk through the rest of my long extended life together with. And we're just happy. Happy people attract other happy people. If anybody wants my advice on clinical nutrition, if you seek clinical nutrition advice or an extensive report on your particular condition, text me. I need help to 702 580-0662. And I will be happy to help you to the best of my abilities. So if you do, don't hesitate. Please don't. I've got a couple of more of these references that I used for today. And I actually have a bunch of them. I pulled like 60 of them up inside one of my in Notebook LM. Notebook LM is real complicated. I'm still learning it, and I've been using it for 3 weeks now. I'm still learning it. It's real powerful, but it is complicated. But we do encourage you to do the best we can with all of the wonderful benefits that our Creator gave us. And we are on it. I'm going to paste up this link to, if you want to contact me again, I got your back. So on that note, I want to thank you all for being a part of what we do here on LIB Radio and LIB TV. You are undeniably the solution to your health situation. I am merely the conductor of the train here, or we call LIB Radio and the Conscious Rasta Report. Tomorrow, I've got a guest who's going to be joining me from East Africa. We're going to be talking about the same things we talk about on Mondays and Tuesdays, but he's doing them in Kenya. And I look forward to working with a good brother in Kenya in the future on these various topics. So you've been tuned into your favorite. We aim to be your favorite. We are LIB Radio, LIB TV. We are livinginblack.com. Tell your friends to tell their friends that we have our own now. And we are all about solutions. Peace and prosperity to each and every one of you on your favorite. We aim to be your favorite. We are LIB Radio, LIB TV. We are livinginblack.com. Peace, y'all.